Hi everyone, welcome back to my channel. Today we're going to explore the fascinating world of pediatric nursing theories. You know, as a nurse, I'm always fascinated by the different ways we approach healthcare, and understanding the theories behind pediatric nursing is crucial for providing the best possible care to our youngest patients. Think about it. Kids aren't just small adults. They have unique needs, developmental stages, and ways of experiencing the world. That's where these theories come in. They provide a framework for understanding how children grow, learn, and cope with illness. Just like we use different tools for different jobs, we need different theoretical approaches to address the diverse needs of our pediatric patients. Whether it's understanding a child's emotional development, supporting their families during a hospital stay, or promoting a sense of comfort and security, these theories give us the knowledge and skills to provide truly holistic care. So get ready to dive in with me as we unlock the power of pediatric nursing theories. We'll explore the key concepts, applications, and implications of each theory, giving you a solid foundation for providing exceptional care to children of all ages. Let's get started. First up, we have Erikson's Psychosocial development theory, a cornerstone in understanding child development. Now, Erikson proposed that our personalities develop in a predetermined order through 8 stages from infancy to adulthood. Each stage presents a unique challenge or crisis that needs to be resolved for healthy emotional and social growth. Think of it like building a house. Each stage is like laying a new foundation, and if one stage isn't strong, it can affect the stability of the whole structure later on. For example, in infancy, the crisis is trust versus mistrust. If a baby's basic needs are met consistently, they develop a sense of trust in the world. But if their needs are neglected, they might develop mistrust and have trouble forming secure attachments later in life. See how crucial those early years are, and that's just the first stage. As children progress through each stage, they face new challenges related to autonomy, initiative, industry, and identity. In pediatric nursing, understanding these stages is essential because it allows us to tailor our care to meet the specific developmental needs of each child. We can provide age-appropriate support, encourage healthy emotional development, and identify potential areas where a child might be struggling. So, how do we actually apply Erikson's theory in a practical setting? Well, let's say you're caring for a toddler who's just been hospitalized. According to Erikson, toddlers are in the stage of autonomy versus shame and doubt. They're developing a sense of independence and want to do things for themselves. In a hospital environment, it's easy for them to feel a loss of control, which can lead to regression, tantrums, or withdrawal. But armed with this knowledge, you can empower your little patient by giving them age-appropriate choices. Instead of saying, "It's time for your medicine," you can offer 2 options. Would you like to take your medicine with apple juice or orange juice? See the difference. You're still ensuring they take their medication, but you're also fostering their sense of autonomy and making them feel like an active participant in their care. Similarly, for a school-aged child in the industry versus inferiority stage, providing opportunities for them to engage in meaningful activities even while hospitalized can be incredibly beneficial. This could be as simple as letting them help organize their medical supplies, giving them art supplies to express themselves, or even having them teach you about their favorite topic. These small but significant gestures can make a world of difference in their emotional well-being. Now, we can't talk about Erikson without emphasizing the importance of play and social interaction. Play is essential for children's development, and it's through play that they learn about themselves, others, and the world around them. In a hospital setting, play can be therapeutic, providing a sense of normalcy, distraction from discomfort, and an outlet for emotional expression. Encourage families to bring familiar toys from home and create a playful environment within the limitations of the hospital room. Social interaction is equally crucial, especially for children experiencing illness or hospitalization. Peers provide a sense of belonging, support, and normalcy that adults simply can't replicate. Encourage visits from friends and siblings whenever possible, adhering to hospital guidelines, of course, and don't underestimate the power of simple interactions. A warm smile, a silly joke, or a few minutes of engaging conversation can go a long way in brightening a child's day and fostering a sense of connection. Remember, as pediatric nurses, we're not just treating illnesses, we're caring for the whole child, and that includes their emotional and social well-being. Next up, we're diving into the world of Piaget's cognitive development theory. Now, Piaget was a rock star in the field of child psychology, and his theory focuses on how children think, reason, and understand the world around them. He proposed that cognitive development happens in distinct stages, with each stage characterized by a different way of thinking. Unlike Erikson's focus on psychosocial development, Piaget helps us grasp how children's intellectual abilities evolve over time. Imagine a child trying to make sense of a magic trick. A toddler might believe the coin actually vanished, while a school-age child understands the concept of illusion. That's because they're in different stages of cognitive development. Piaget identified 4 primary stages: sensorimotor, preoperational, concrete operational, and formal operational. In the sensorimotor stage, infants learn through their senses and motor actions. They put everything in their mouths, explore objects with their hands, and gradually develop object permanence, the understanding that objects continue to exist even when they can't be seen. This stage is all about sensory exploration and motor skills. As children transition into the preoperational stage, typically around age 2, they begin to use language and symbols to represent objects and ideas. They engage in pretend play, using their imaginations to create scenarios and stories. However, their thinking is still quite egocentric, meaning they have difficulty seeing things from another person's perspective. They might tell you about their dream in vivid detail, assuming you were right there with them. Around age 7, children enter the concrete operational stage. They start to think more logically, understand cause and effect, and grasp concrete concepts like conservation. The idea that the amount of something remains the same even if its appearance changes. For example, they understand that pouring juice from a tall, thin glass into a short, wide glass doesn't change the amount of juice. Finally, in the formal operational stage, typically starting around age 11, children develop abstract thinking, hypothetical reasoning, and problem-solving skills. So, how does Piaget's theory translate to real-life pediatric nursing? Well, it helps us tailor our communication and teaching methods to match a child's cognitive abilities. For instance, when explaining a procedure to a preschooler in the pre-operational stage, using simple, concrete language and visual aids like dolls or drawings can be much more effective than complex medical jargon. Similarly, when providing education to a school-aged child in the concrete operational stage, hands-on activities, experiments, or demonstrations can enhance their understanding far more than lectures or abstract explanations. Remember, children are not just passive recipients of information. They actively construct their understanding of the world through exploration, interaction, and experience. By aligning our care with their cognitive stage, we can empower them to learn, adapt, and thrive. Alright, let's dive into a fundamental aspect of pediatric nursing family-centered care. This isn't just a nice to have. It's a core principle that can significantly impact a child's well-being. Now, you might be thinking, of course families are important, but family-centered care takes it a step further. It recognizes that parents and guardians aren't just visitors in the healthcare journey. They are essential partners. We're talking about actively involving families in decision-making, keeping them informed every step of the way, and respecting their cultural beliefs and values. It's about creating a supportive and collaborative environment where everyone feels heard and respected. Remember, when a child is hospitalized, it impacts the entire family unit, and their well-being is directly tied to the child's recovery. So why is family-centered care so crucial? Well, studies have shown time and time again that it leads to better health outcomes for children. When families are involved, children tend to experience less stress and anxiety, which can aid in their recovery. Think about it. A child who feels safe and secure with their loved ones nearby is more likely to cope better with procedures, treatments, and the overall hospital experience. This can lead to shorter hospital stays, reduced readmission rates, and improved pain management. But the benefits extend beyond the child. Parents and guardians who feel supported and informed are better equipped to care for their child after discharge. They can confidently manage medications, understand follow-up appointments, and provide the necessary emotional support. Family-centered care is a win-win situation. It empowers families, strengthens the bond between healthcare providers and families, and ultimately leads to the best possible outcomes for the child. Now, how do we actually implement family-centered care in a practical way? It starts with a shift in mindset, viewing families as true partners in care. This means actively listening to their concerns, respecting their expertise on their child, and involving them in developing care plans. Communication is key. Clear, honest, and empathetic communication can make all the difference in building trust and rapport. Explain medical jargon in simple terms, encourage questions, and be available to address any anxieties or fears they might have. Remember, every family is unique and their needs will vary. Flexibility and cultural sensitivity are crucial, Some families may need additional support with language barriers, financial constraints, or navigating complex medical information. By embracing family-centered care, we create a healthcare experience that is not only medically sound, but also emotionally supportive and truly patient-centered. Let's shift gears now and delve into another important theory in nursing, particularly relevant to pediatrics, Gene Watson's theory of human caring. This theory beautifully emphasizes the human connection at the heart of nursing care. In a nutshell, Watson's theory posits that true healing goes beyond just treating physical symptoms. It recognizes the importance of addressing the emotional, spiritual, and social needs of the patient and their families. Think about it. A child in a hospital bed isn't just a patient with an illness. They're a young person experiencing fear, uncertainty, and possibly loneliness. Watson's theory reminds us to approach each interaction with empathy, compassion, and a genuine desire to understand their unique perspective. Watson outlines 10 Caritas Processes, which are essentially core principles that guide compassionate care. These processes emphasize creating a caring environment, developing a trusting relationship, and truly listening to the patient's needs and concerns. For example, one Caritas process is about practicing loving kindness and equanimity. This means treating every individual with respect and dignity, regardless of their background, beliefs, or behavior. Another process highlights the importance of being present, giving your full attention, actively listening, and providing emotional support. In a pediatric setting, these Caritas processes are even more crucial. Children are particularly sensitive to their surroundings and the emotions of those around them. A caring and compassionate approach can significantly impact their emotional well-being and ultimately their healing journey. So how do we translate Watson's theory into tangible actions in a pediatric setting? It starts with simple gestures, a warm smile, a gentle touch, taking the time to play a game, or simply sitting and listening to a child's fears. Creating a healing environment is key. This could involve decorating the hospital room with cheerful colors, providing age-appropriate toys and activities, and encouraging family involvement to create a sense of normalcy. Remember, children communicate in different ways. Be observant of their nonverbal cues, their facial expressions, body language, and tone of voice. These can provide valuable insights into their emotional state. By embodying the principles of Gene Watson's theory of human caring, we can create a healthcare experience that is not only clinically effective, but also nurturing, compassionate, and truly focused on the holistic well-being of the child. Hey future nurses, today we're diving into two important models in pediatric nursing, Roy's adaptation model and Levine's conservation model. These models offer valuable frameworks for understanding how children cope with illness and hospitalization. Roy's adaptation model, developed by Sister Callista Roy, views the patient as an adaptive system. Basically, it emphasizes the incredible ability of kids to adapt to changes in their environment and health. When a child faces an illness, it's like a curveball thrown their way. Their little bodies and minds work hard to adjust and find a new state of balance. As pediatric nurses, we play a crucial role in supporting this adaptation process. We can help by minimizing stressors, promoting a sense of control, and providing education and resources to both children and their families. Remember, a supportive environment can make all the difference in a child's healing journey. Levine's conservation model emphasizes the importance of minimizing energy expenditure during a child's illness. Think about it, when we're sick, we often feel tired and drained, right? Well, the same goes for kids, but even more so, their little bodies are working overtime to fight off infection and heal. So how do we conserve energy in a pediatric setting? We can cluster our nursing care, meaning we do all the necessary tasks in a shorter time frame to allow for longer rest periods. We can also make sure the child's room is calm and quiet, minimizing unnecessary stimulation. Another important aspect of Levine's model is promoting structural integrity, which means protecting the child's physical body from injury. This can involve using proper positioning techniques to prevent pressure sores, ensuring safe medication administration, and preventing falls. And we can't forget about personal and social integrity. Hospitalization can be a scary and isolating experience for children. We need to maintain their sense of self and connection to loved ones, encouraging visits from family and friends, allowing children to wear their favorite pajamas, and incorporating play into their day can make a huge difference. So, how do these models translate into real-life pediatric nursing? Well, imagine a young child admitted to the hospital with pneumonia. They're struggling to breathe, they're hooked up to machines, and their parents are understandably worried sick. Using Roy's adaptation model, we can identify the stresses this child is facing: difficulty breathing, unfamiliar environment, separation anxiety. Then we can develop interventions to help them adapt. We can provide oxygen therapy to ease their breathing, create a welcoming and child-friendly atmosphere in their room, and encourage parents to stay with their child as much as possible. Now, let's apply Levine's conservation model. We can conserve the child's energy by minimizing unnecessary procedures, grouping our nursing care to allow for longer rest periods, and creating a calm and quiet environment. We can protect their structural integrity by ensuring proper positioning to prevent skin breakdown and using age-appropriate equipment to prevent falls. And of course, we can't forget about personal and social integrity. We can encourage the child to express their feelings, engage in therapeutic play, and stay connected with their loved ones through phone calls or video chats. Now let's shift gears to another fascinating theory that has a huge impact on pediatric nursing, attachment theory. Pioneered by John Bowlby and Mary Ainsworth, this theory explores the profound impact of early relationships on a child's emotional and social development. Think back to your own childhood. Remember those special caregivers who provided you with love, comfort, and a sense of security. Those early bonds shape who we become as individuals, influencing our relationships, emotional regulation, and overall well-being. In a nutshell, attachment theory suggests that infants have an innate drive to seek proximity to a primary caregiver, especially when they're feeling stressed, scared, or vulnerable. This secure base provides a safe haven from which they can explore the world and develop a sense of independence. Now, you might be wondering, how does this relate to pediatric nursing? Well, imagine a young child admitted to the hospital, separated from their parents, and thrust into a foreign and often frightening environment. Their sense of security is shaken, and their attachment system is activated, triggering a cascade of emotions. It's important to note that not all children develop the same attachment style. While a secure attachment is ideal, some children may develop insecure attachment patterns due to inconsistent, neglectful, or traumatic early experiences. For example, a child with an anxious resistant attachment style might become clingy and distressed when separated from their caregiver, displaying intense separation anxiety. They may crave closeness but simultaneously resist comfort, exhibiting a push and pull dynamic. On the other hand, a child with an anxious avoidant attachment style might appear emotionally detached and independent, seemingly unfazed by separation. However, this outward indifference is often a coping mechanism to mask their underlying distress. As pediatric nurses, it's our job to be attuned to these different attachment styles and adjust our care accordingly. Understanding a child's attachment history can help us anticipate their needs, respond sensitively to their cues, and create a supportive environment that fosters a sense of security. So, how can we apply attachment theory in our day-to-day interactions with pediatric patients? First and foremost, we need to recognize the importance of the parent-child relationship. Parents are not visitors in the hospital, they are essential members of the care team. We should encourage parents to be actively involved in their child's care, providing comfort, reassurance, and a familiar presence. We can also educate parents about the importance of maintaining routines and rituals as much as possible, as this can provide a sense of normalcy and predictability during a stressful time. For children with insecure attachment styles, we might need to provide additional support. This could involve being extra patient and understanding, offering consistent and predictable care, and using therapeutic play to help the child process their emotions and build trust. Remember, building a strong, trusting relationship with our pediatric patients is crucial, especially in the healthcare setting. By providing a secure base and responding sensitively to their needs, we can help them cope with the challenges of illness and hospitalization and promote their emotional well-being. And that's a wrap on our deep dive into pediatric nursing theories. We've covered a lot of ground, from Erikson's psychosocial development theory to attachment theory. Remember, these theories provide valuable frameworks for understanding the complex world of children and their unique needs. By applying these concepts in our practice, we can provide compassionate, evidence-based care that supports the physical, emotional, and social well-being of our youngest patients. Thanks for watching, and don't forget to subscribe for more nursing content.